Good morning. I'm Thursa Sloan, Floyd County Health Department Director, and we are here this morning with Judge Robbie Williams and Mayor Les Stapleton to do a little update on our status with the COVID-19 virus that's really increasing in the state of Kentucky. Just a little bit about our current situation. Our numbers have increased steadily since Thanksgiving. We had 439 cases in November and 637 cases in December, and since January the 1st we've already had 147 cases. So that kind of gives you an idea of the spike that's going on right now. Our positivity rate's around 13.9, our incident rate's 91.1. So we are getting in a situation here, folks, and we really are going to try to talk to you today about what we have to do and re-emphasize the need for social distancing, getting your vaccination, washing your hands, and doing things that you can do to protect your family, such as avoiding crowds, starting to limit your activities. We're not asking you to lock yourself in your house. We're saying be sensible, use your mask when you're out, and practice these things to try to slow this virus down. And please, if you haven't been vaccinated, do get vaccinated. Right now we have 18 people in the hospital. 2 of those folks are fully vaccinated. 1 is in the unit, not critically ill, but being monitored, and they do have a lot of underlying health conditions. So we are asking that you, if at all possible, get your vaccination. If you haven't had your booster and it's time, we ask you to get someplace and get your booster. Those are available for a wide range of ages, and it's been 6 months since your second dose of Moderna or Pfizer, or 2 months since your last dose of J&J, then you are eligible for a booster shot, and you really do need to get it. Does the vaccine keep you from getting the virus? No, not necessarily, but we can see by our numbers it is definitely lowering the severity of illness. Have we had as many deaths? Not as we did initially prior to the vaccine, which should tell you the vaccine does work. But we have had, as of this morning, 147 deaths in Floyd County since our first case of COVID-19 on April the 14th, 2020. So that's kind of a report from the health department. We're going to talk a little bit, Judge Williams is going to talk a little bit about information he could share from local hospitals and what's going on in the county.
Well, I guess the big thing that folks are asking is, why now? Why are we back talking about the COVID today? As the numbers are increasing, I think folks are getting a false sense of security that this thing has disappeared, it's gone, we've beat it. Well, we haven't. The numbers are increasing, and my concern is that as the numbers increase, the information that we're getting from the state is they're going to steadily increase to the end of the month, maybe into the first week of February. So what's happening as those numbers increase, we've now been told that there's going to be limitations on the testing and the monoclonal antibodies that are going to be out there. So there's only going to be limited testing and limited infusions going forward. So as the numbers increase, that false sense of security that we've had for the last 12 months, because people say, well, if I get sick, I go get the antibodies, I'm fine. They're not going to be there. So what we're emphasizing to folks is you've got to mask up. You have to think about where you're going. You have to think about social distancing, how you interact with people. If you have a compromised immune system, because what it's going to come down to is everyone will not have access to the antibodies going forward. There will be a criteria that they use. So there will be people who get sick that will not have access to those antibodies. And the majority of the people that are getting the antibodies are the folks who have been unvaccinated. That's statistically proven. The folks who are getting the antibodies are the folks who have not been vaccinated. So you need to protect yourself and protect your family, because this is a serious situation. As hospital beds are filling up, the medication, the treatment is going to start declining, the testing starts declining, and we have to take this serious. We're asking employers, if you're in a situation that you have folks coming in you're a sales office, restaurants, things of that nature, let your folks wear masks and try to go back to the social distancing that we had before, because we don't want people sick. It's back. This is not the Omicron variant that we have in Eastern Kentucky right now. This is still the Delta, and it's deadly. So you need to think about that as these numbers spike, and think about masking up. And if you have a compromised immune system or you're a senior citizen, you don't need to be out without a mask on. That's all I have, Les.
You know what it all boils down to? Common sense. You know, at winter time, we always have a flu, and we have a flu out there right now. And that flu added with the COVID makes it twice as bad. It's easier for pneumonia to set up. Wash your hands, be smart. There comes a point when I don't care what the health department does, the judge does, or I do, we cannot be responsible for y'all for every move you make. You gotta use common sense, and what you have to do is take account for yourself and the people around you. If you have someone in your family who is immune deficient, or is older, or has those underlying medical conditions that create problems, be smart about it. Don't put them in harm's way. Don't put yourself in harm's way. So it all boils down to wash your hands, wear a mask when you're in crowds that you don't know who's there and what's going on. And people, it's not that hard to social distance a little bit. I've learned to talk a little louder. Of course, y'all know I got a loud voice anyway, but I've learned to talk a little louder across the room as opposed to in somebody's face. So be smart, listen to the experts, whether you believe in the vaccine, whether you don't, whether you believe, use common sense, and we can all get through this.
Well, we appreciate you all listening. Thursday, you got anything else you want to add?
No, I just, like Les said, be smart and stay safe.
Yeah.
We can do this.
Thank
Yep.
you, Alan Bowling, for coming out and filming this for us.
Yeah, and you know, here's the thing, folks, the numbers are going to continue to increase. The treatments are going to decrease that are available. That's the reason for this, us doing this, is folks need to understand everyone will not have access to the monoclonal antibodies going forward. There will be a criteria that they use to determine who gets them. So we're just asking folks to try to prevent getting the COVID as much as possible. Thank you. We appreciate you taking the time to watch our video.